This is a video on how to recognize an opiate overdose and how to administer the medication Naloxone, or better known as Narcan. Naloxone is a medication that reverses the effects of an opiate overdose. So how do you recognize an opiate overdose? One is the person is unresponsive, or the person might have a bluish grayish color around the lip area or fingernails. Their skin is cold and clammy, and they have a distinct snore that happens that some people kind of recognize as a death rattle snore. So you want to make sure it's an opiate overdose and see if you can get that person responsive. We suggest is what's called a sternum rub or chest noogie. You would take your knuckles and rub very, very hardly on the chest bone. Hopefully they will become responsive at that point in time, and then you would call 911. If they're unresponsive, you would still call 911, put it on speakerphone, and let them know you're going to administer the medication Naloxone and or Narcan. So there's two types of Naloxone or Narcan. One is the nasal. There's always 2 doses in each kit that's provided. You would open up the package, take one of the nasal apparatus, stick it in the nostril completely, press the trigger, administer the medication, take a step back to see if the person becomes responsive. If it's intramuscular, it does involve a needle and a vial. Uncap the needle, introduce a little air into the vial, draw all the medication into the syringe, and you would administer it in either the shoulder area or thigh area. If they become responsive after the medication is administered, you would get them in what we call a recovery position, which you would lay them off to one side with one arm over in case they vomit, and they're in a safe position at that point in time. If they are unresponsive, we want you to support ventilation. We always say the best way to reverse an overdose is to get that person breathing again. So you have 2 choices. One is rescue breathing. The other is chest compressions. Rescue breathing is similar to CPR. You would lay the person down, check the mouth to make sure there's no food particles or anything else in there. Pinch the nose, lift the chin, 2 breaths to engage the chest, and do 1 breath every 5 seconds for 2 minutes. For chest compressions, again, like CPR, you would lock your hands center of the chest bone, and you do chin over hands. Try to do 100 compressions per minute for 2 minutes. If the person becomes responsive after rescue breathing, again, into the rescue position. If not, you would administer the second dose of naloxone